Started. If that's okay, my name's Akila Peoples. I'm CEO of Mental Health Research Canada, and we're very pleased that you have joined us today for this exciting knowledge sharing event. Although Mental Health Research Canada is a national organization, I am chairing this knowledge sharing event from Toronto on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And we are most grateful and respectful of the very important history of this land. We're very pleased that we've had such great response to this webinar today. We have 3 presentations for you with an accomplished group of researchers that are going to be sharing their work with you. I believe we have well over 90 registrations, not just from Saskatchewan, but from Quebec, Nova Scotia, Alberta, Newfoundland, BC, Ontario, many other mental health organizations, provincial and federal governments. And we're just delighted that so many folks are interested in learning about this important work that's being done in Saskatchewan. But before I go any further, very important for us to spotlight our wonderful partnership with the Saskatchewan Health Research Foundation. We have been partnering with them for many years now on many important grants and studentships, and they're a pleasure to work with, and they're a like-minded partner in that they care deeply about the engagement of community and people with lived experience and stakeholders in the research process. So we are just very proud to have such a great partnership with Saskatchewan Health Research Foundation. Now, I know Patrick Ognokin, their president, is a great champion of our partnership, and I meet with him often. I know he wasn't available today, but I think Karen Tinsley, Director of Programs and Partnerships, is with us to say a quick couple of words of welcome. Karen, are you with us?
Yeah, hi. Thanks, Akila.
Hi, Karen. Welcome. Great to see you.
I think you must have had my notes for talking about our partnership. Yeah, ditto. Lots of, philosophical and strategic alignment between our organizations. So it's been really great to kind of leverage each other's capabilities and reach. When Akila told me how many people were registered for this is just, evidence of how great it is to have for us to have that connection and that national reach with MHRC. So yeah, really happy for that, and they're really looking forward to hearing about the projects and how they've been going. I know this particular opportunity, as Akila mentioned, we've had a few partnerships together, but this particular opportunity came out of that sort of a need for research that Mental Health Research Canada saw from their data collection across the country for support during COVID. So another great thing about our partnership, just being able to work together to respond to that need. So yeah, thanks everyone.
Thank you so much to Karen and your team. It is a pleasure partnering with you. Just a couple of notes from me, and then we'll get started with our first presentation. We do have a busy agenda today. 3 research teams will be presenting. My intros of them will be brief, just by way of name and university of the presenter themselves, because they're going to tell you a lot more about the work and their colleagues. Each team has 15 minutes to present. We're hoping there may be an opportunity for questions if they finish a little bit before the 15 minutes. We're a few minutes ahead of our schedule right now, which is great, which means we might be able to take some questions at the very, very end of the 3 presentations as well. I do want to acknowledge that I am going to be giving each presentation a notification, a verbal notification at the 13-minute mark, again, just to make sure we stay on time and that each team has the full 15 minutes available to them. I would encourage participants to use the chat, presenters as well, if there's information that you want to share in the chat. Also, I know some of you are comfortable with follow-up from participants. I think some of you have put your email at the end of your presentation, or you may put it in the chat so that participants can follow up with you post-presentation. This session's being recorded, so this also will be on our website so that others can view it after today. And I believe my last note is that it would be wonderful if we could, presentation team, if we could all stay off video except the one or two people that are presenting at any given time. That would be terrific if we're all okay to accommodate that. So without further ado, we're going to jump right into our first presentation. And our first presentation, I'm going to introduce and hand over, and I know he's going to put a PowerPoint presentation up to support his presentation, Dr. Geoffrey Maina from the University of Saskatchewan. Wonderful to see you, Dr. Maina, and over to you.
Thank you very much for the for that invitation. I'm going to put my slide here and share it. Let's see. Okay.
We see your screen. Wonderful.
Okay. All right. Excellent. All right. As I have been introduced, my name is Geoffrey Maina. I'm associate professor with the College of Nursing, University of Saskatchewan. I'm actually based in a small city of Prince Albert. University of Saskatchewan has 3 campuses, the main one being in Saskatoon, the other one's Regina, and then Prince Albert. So I am presenting on behalf of my colleagues, and the title of our project is Co-Developing Mental Literacy and Self-Care Resources for Racialized Newcomer Youth in Regina, Saskatchewan, a youth-led participatory action research. And first of all, I would like to make a loud acknowledgement. And I would want to say that I acknowledge that I live and work on Treaty 6 territory and the homeland of the Métis. I pay my respect to the First Nations and Métis ancestors of this place, and I reaffirm my relationship with one another. So just to give some background statistics, we don't have a lot of statistics about immigrant youth, but we know that in the last years, youth coming to Canada aged between 12 to 17 years have actually comprised of between 22 to 50% of the immigrants. And as you're going to see in the next slide, Saskatchewan is becoming a very interesting place for the immigrant population and has actually seen an increase in the number of immigrants that are settling in the province. And currently, the ethnic minorities comprise of 21% of the population. So this may be a little bit dated graph, but although the statistics are old, I think the trend is similar, if not more or better. And what we're beginning to see is that the province has actually experienced an exponential growth in the number of racialized immigrants that are coming to settle in the province. And as you can see, I've highlighted there that apart from the Nunavut, which has a 142% increase in the number of racialized communities that are settling in the province, Saskatchewan actually seems to be doing better, way better than other provinces. And I know that the province has a plan to increase its population. Currently, we stand at about 1.2 million people. So the province of Canada has an intention of increasing its population by 300,000 in 10 years. And that would likely be through immigration. And so we are likely to see the proportion of immigrants in the country increasing up to about maybe 25% of the population in the next 10 years. So that kind of gives us a need for us to have a focus of the interest of the immigrant population. So we know that immigration to a country provides a person with an opportunity for a new start. And we always tend to focus on the positive aspects of immigration, but oftentimes we actually don't pay attention to really what happens to the person who is immigrating. And in this slide, I just want to briefly indicate that whereas there are so many positives that immigrants experience when they move to a country like Canada, but there are also the negative aspects of immigration, particularly with regard to the youth. For instance, if the youth come to Canada as refugees, they're likely to struggle with the trauma, which may not be addressed within the healthcare system. And also, sometimes the youth may struggle with the tension to meet the demands of two cultures. That is, the culture from the home where they are coming from and the culture in the country that they now find themselves in. But you also do know that what parents are experiencing, for instance, if they have mental health struggles, or even they're struggling with things like addiction, they're going to have a very profound impact of the mental well-being of the youth. And when the youth go to school, depending on when they come to Canada, they are likely to experience things such as racism, bullying, discrimination, or even social exclusion. And those are issues that are likely to increase their risk of experiencing mental stresses. So despite the known risk for mental illnesses that immigrants youth might face, they are likely to experience a lot of barriers that may hinder them from accessing the care that they need. And these are likely to be things to do with accessibility, provider-patient interaction, which is some of the providers, especially if they're not culturally competent, they're not likely to understand the unique needs of the immigrant youth. Circumstantial challenges, such as where they live, their ability to navigate the healthcare system, issues of language, stigma, as well as fear. Now, as I was looking around to see whether there's any policy document, I was actually encouraged to know that the Mental Health Commission of Canada recognizes the risks that the immigrant youth face. And in addition to the social determinants of health, which all of us, I'm sure we know, such as income, employment, access to health services, culture, and social support, they have recognized 4 more additional determinants of health that are likely to have an impact on the risk of the immigrant youth. And these are to do with the exposure to victimization of violence, parental mental health or substance use, issues of food insecurity that immigrant youth are likely to experience compared to non-immigrant youth, as well as some of the youth are likely to be care providers for their families, and therefore the strain and burnout that may come as a result of a caregiver burden might have a huge impact on the mental health of the immigrant youth. Now, both the Mental Health Commission of Canada and the Saskatchewan Mental Health and Addiction Plan have something to say about the immigrant youth and their need for mental health services. And as you can see, I've circled those 2 documents that I've just put screenshots side by side. And for the Saskatchewan Action Plan, the system goal is to respond to diversity. Whereas for the Mental Health Commission of Canada, the idea within the strategic direction 4 is to improve the mental health of immigrant, refugees, and racialized groups. However, the big question is, are these policy directives translated into programs and practices? Now, how did this project come about? So at a meeting with the stakeholders who are involved in providing social medical services to newcomers in Regina, it was reported that there's an increase in the number of newcomer youth seeking mental health services in Regina. And it was also acknowledged that there is now known culturally appropriate mental health services for newcomer youth in the city. And so when I did a cursory scan on the web, it yielded very limited evidence on any program and interventions that are germane and specific to the mental well-being of this population. And at the same time, I'm sure we are not going to be surprised that there's limited literature or statistics on the prevalences of mental health issues facing immigrant youth. And the few studies that I could find were only based in Ontario and British Columbia. And therefore, we set ourselves on this journey by bringing together researchers, physicians, and people with deep experiences when an opportunity arose to apply for the Mental Health Research Canada grant. And we titled our project called Developing Mental Health Literacy and Self-Care Resources for Racialized Newcomer Youth in Regina, a youth-led participatory action research. And we hoped that through this work, that we could understand the impact specifically on immigration on their mental well-being, and together develop a resource to support the mental self-care. And so we intend, as we do so, to build capacity for the immigrant youth themselves to be involved in research work, as well as in the future to have the tools that they need to engage in advocacy, to be able to advocate for the improvement of their well-being. So in terms of the methodology, we are utilizing community-based participatory research. And as you know, that it utilizes the principles of social justice, self-determination, and empowerment. And this ensures that participants are actively involved in all the phases of the research process. And actually, before the research project began, we constituted a community advisory team that comprises of racialized youth aged between 60 to 25, who we meet frequently, and we consult them actively as their advisors about how to go about this work. So this research is divided into 4 phases, and I'm going to briefly talk about them. So phase 1, because of the lack of statistics on the prevalence of mental health issues among the racialized population, we decided to conduct an online survey to capture some information about the knowledge of mental illnesses, about the rates of mental illnesses, access to mental health services, as well as the need for support to maintain their mental wellness. And so this phase has just been completed, and we are in the process of analyzing data. In phase 2, which we call the photo voice phase, we are going to provide the youth with a camera, which they are going to use to capture both the negative and the positive impact of immigration on their mental well-being. So this methodology, as we know, is called photo voice, is commended because of its emancipatory properties. And so we are going to train the participants on how to use a camera, how to take photography, and we are going to provide them with the support during that photography window. So the people that we are looking for, so that they can participate in this phase, they need to be immigrant, aged between 16 to 25 years old. They need to have been in Canada for not more than 7 years. They need to self-identify as ethnic minority. They need also to have a self-reported mental illness, as well as if they happen to be students, we want them to have been in Canada for at least 2 years so that they could have had an opportunity to have an experience of what it means to live in Canada, so that they can be able to be able to have a perspective one way or the other about the impact of immigration on their mental well-being. So once the photo voice phase is completed, we plan to host an exhibit with the selected photos in Regina in one of the art galleries. And then we are going to have, for each photo that we are going to exhibit, it's going to have a caption that describes, using the immigrant youth words, about the meaning of the photos. And we hope to invite community members, and we are going to have the exhibit open for a period of 1 week. And so we believe that this is our way of raising awareness of the mental health needs of the immigrant youth. And collectively, we can imagine what kind of service they might need in order to maintain their mental well-being and engage in self-care. So we hope to attract policymakers, decision makers, service providers, as well as community members to come to the event, because we are going to have an envisioning exercise at the end of it all so that we can be able to identify priorities.
Dr. Maina, you're at 13 minutes.
Okay, thank you. So, and because the overall goal is to develop self-care resources, we are going to come up with a working group, which is going to help us to explore and develop a mental wellness resource for immigrant youth. And after this, we are going to pilot the intervention. And once we refine it, we are going to give it to the settlement agencies for adoption. So what challenges are we experiencing? So there are issues of hesitancy because not many youth have ever participated in research. Mental health stigma is a little problem, and many people are feeling very uncomfortable coming forward. And therefore, we believe that we need more time to build trust with potential participants and use active recruitment strategies. Finally, despite the challenges we are experiencing with recruiting participants, we see a lot of value in the work. And therefore, we are going to make sure that this work is done well, no matter how long it takes. Because we believe that through this project, it's going to give voice to the youth, increase awareness and address stigma, and provide a way to engage the stakeholders, increase space for youth to talk about the issues that can be challenging, such as mental health. And therefore, we also hope that through this work, we can build capacity for the immigrant youth themselves to engage actively in advocacy, policy development, and other interventions to ensure that the directives of the action plan and strategic directives are realized. Thank you very much for listening to my presentation. And this is my email address in case anyone wants to follow up with the work that I've just presented. Thank you.
That's wonderful, Dr. Maina. Maybe you could leave that slide up just for one moment. I don't see any questions in the chat. Thank you so much for staying perfectly within the timelines of very deep engagement of people with living experience in this work. We're really looking forward to the results of it. And I know it's an important partnership with the Regina Community Clinic, and we're very much looking forward to seeing how this work evolves. So thank you so much for being here today. And if it's okay, we're going to move on to our next presentation. I invite you to stay in case there are questions at the end, and you're more than welcome to also put your contact information into the chat. Wonderful work. Thank you so much. Congratulations for being funded on this.
Thank you.
Our next presentation. Apologize, I should have put myself back on video. Our next presentation is being presented by Dr. Charity Marsh and Dr. Natalie Reed from the University of Regina. So I will hand over to you now, Dr. Marsh and Dr. Reed.
Super, thank you so much. So let's just get right into it here. Oh, I've got to figure out how I'm going to change my slides. 1 second here. Oh, it's not going to work for me.
I don't know that it went into full screen. You know how you did the,
let's see here.
File full screen? I'm not sure.
Here, it's working now, I think. Yep, here we go. Perfect. Thank you so much. Here we are. So Take Up Space You Matter was held on Treaty 4 lands in the city colonially known as Regina. And the research team and all three of our community partners acknowledged that these are the territories of the Nehewak, the Anishinaabeg, Dakota, Lakota, and Nakota, and the homeland of the Métis Michif Nation. And one of the things we did think very deeply about as in our conversations collaboratively was thinking about how best we could think about what it might mean to create and think about programming through an anti-colonial lens. So that was something that was very much part of that in understanding. So Take Up Space You Matter, fostering reconnection through trauma-informed community arts programming is a collaborative approach. And we have the research partners, University of Regina, which houses the Humanities Research Institute, which I'm the director of, and also the Child Trauma Research Center, which Natalie is the director of. We also have our funding partners, Mental Health Research Canada, and also Saskatchewan Health Research Foundation, which we are very thankful, grateful for to do this work. But I think I saved the best in the sense of why we do the work that we do, and that is to work with our community partners and the youth and the children that we the participants of this project. And it really came from these community partners. So again, community-based research, thinking about what is actually the need and the desire and wants of the community. So the three partners, GRR, formerly known as Girls Rock Regina, is a music-oriented organization, Vibes, YQR, a street dance, grassroots organization, and then Femmes Across the Board, which is a skateboarding. So thinking about arts and movement here. All three, as I said, are grassroots. They all work very hard to create, develop programming. They support often marginalized communities within youth and the categories of youth and children, and they do it through arts practices. And so if we think about what has happened, the context, we know within the pandemic, there was great disruption of that programming. And with that, of course, we also know there's a lot of disconnection, isolation of young people. And so one of the things, I says over a year ago, the sort of context, what came out was, as we start coming back together, and as young people start coming back together, how could we best support them to reconnect? And how do we best support organizations that do this really critical and important work to also connect back with the communities that they serve? And so our research question here, how can trauma-informed community...
Charity, Charity, I'm so sorry to interrupt. Your slides, I don't think your slides are moving forward for us. So I'm still on the title slide. So I don't know if maybe you unshare, yeah, and then do the full screen and then share. I don't know if that's possible or.
Sorry, I'm not sure why it's not doing that. I might just get, here, let's do it. I'm doing the full screen mode and then you can tell me. No. Next time I'll just work in the type that I know. I apologize. Jolene, maybe could you just share it for me so we know it's going to work? Did that happen?
Yes, sorry, I'm pulling it up right now.
Thank you. I'm not sure why it's not moving. I think I can keep.
Can you see my screen?
I can see it. So there are community partners, and here's our research question. So how can trauma-informed community arts-based engagement support improved youth mental health and well-being in Saskatchewan in the midst of COVID-19? And so what we ended up doing in relation, first of all, and we can go to the next slide now. Thank you so much. So what ended up happening was first we ended up engaged in consultation with these community partners about what they needed and what they wanted, and if they thought it made sense for us to work together to support them in these kinds of ways. So what would the project look like? Of course, we went through the ethics application process with the community partners, and then we went towards the next phases. And first just one second, sorry, is the facilitator training. Then we went into the workshop series where we held 3 different workshops over 8 weeks in May and June for 2022. Each of the 3 different areas or 3 different disciplines met together once a week at different times. Our ages ranged from 8 years old to 17 years old. And these, they happened at different locations as well. So people had the opportunity, or young people had the opportunity to participate in more than one, although we only had a few folks that did that. And then of course, the data collection component of that is there's the pre and post surveys for participants, the focus group sessions with the facilitators, and of course the research team discussions weekly. So we'll go to the next slide. Jolene, thank you so much. And Natalie.
Absolutely. So I also thank everyone for being here today. And so I'm going to talk a little bit about the facilitator training portion. So when we were thinking about what we were going to do and what we could offer reciprocally, we decided to do a training manual of sorts, but that was also a workbook for the facilitators themselves so that they could work through and engage with the actual materials. And in that facilitator training manual, we had what is trauma-sensitive practices, what are the commitments, what does it look like? And we thought if we could creatively show and engage, then the facilitators would feel like they were really part of the becoming of the project. Can we go to the next slide, please? So within the training manual, we had these preambles. And what we wanted to do is we wanted to frame each time the facilitators met with the young people in their respective art form, we wanted to frame each session with a central commitment or theme or concept of trauma sensitivity. And so then we offered the facilitators a weekly video where we would sort of speak about what that commitment was and how they might engage it in their art form. So they could then take that thinking and weave it into their respective workshops for that week. Next slide, please. So these were the weeks. And as you can tell, we also ordered them intentionally with the idea of starting maybe a little bit easier when people didn't know each other, and then building with confidence and safety and community towards, you know, the final preamble, which was I am a canvas, and then where do we go from here? And so we moved from sort of simpler concepts to more complex concepts. Can we go to the next slide, please? Perfect. So what we found, I mean, it's no surprise that as the young people were together, they said that they definitely felt more connected to themselves and to each other. And really that was the hope of our research question. But we also found many really exciting things. And the youth really self-reported being more engaged. We saw them participating in other community-based activities around that we weren't involved in. They were continuing on. So on this slide, we have two quotations that really came from the post survey. So I really enjoyed being able to be vulnerable and learn new things in an environment where inclusivity and kindness were so prioritized. And I felt very proud of myself for taking the step to participate in the group. I'd always wanted to start skating since I can remember, but never took the plunge. Being a part of this group made me feel very comfortable and suddenly actualized my own abilities to overcome obstacles big and small. Back to you, Charity.
All right, so the participants were open to adventure, learning, and collaboration, and there are a number of key themes that did come out. One in the surveys, and this was around the trust, the process, attunement and relationship, building as trauma sensitive, building community through the art form, so and peer-to-peer connection, of course. Being able to actually share pandemic experiences with other people, with their peers, building confidence and self-esteem, and then of course, sharing experiences of connection and joy. These were really key. On to the next one is the facilitators. Thanks, Sterling. Around So it was an interesting project in that what we kept getting was all this rich, sense of experience that happened at all the different levels. So there was the participant to participant, there was participant to facilitator, there was also facilitator to facilitator. In each of the workshop series, we had two people working together, and they really found beautiful, innovative ways to connect with each other, to the programs, with community. We thought about this. Also, it was generally, I think for the most part, someone a bit more experienced in the art form and someone more junior, but sometimes that typical mentorship role really switched, and it was around trauma-informed practices and experiences, and actually pandemic experiences. So these were kind of a really lovely moments. Indeed, we saw the legacy of the art form as something really important and coming to the fore as a place to articulate lived experience, legacy, breaking out of historical limitations, so breaking through canons and actually really problematizing a lot of the ongoing gendered problems within each of those art forms, the mentoring, so mentoring with the kids, but also mentoring each other, as I talked about, and of course, and the important relationship to the art practice and bringing that back into a public space after being so isolated within the arts.
And can I just add there too, because it was something that really resonated with me, because the facilitators had to sort of engage with the art practice through the lens of bringing it to someone else. They had to really metacognitively engage. So that was another relationship that they shared with us, that with their own art practice, but having to take it in a way that they could teach youth was a really interesting experience for them.
Great, we can go on. So how is the project being taken up and by whom? This is a really interesting moment. You can go on to the next slide for us. So what we've seen is that there's been pivots from the original project. So there are certainly the ways that we intended or that the community partners had hoped, but there are also being exciting and unexpected uptakes. So if you want to go to the next slide for me, the first example is GRR they basically implemented all of the trauma-informed facilitator training and gave it to the GRR staff, board members, and facilitators for the children's summer camp. So it was like a very applicable use of the material that they worked with. They took the facilitator handbook and helped to adapt it. And they also looked at those preambles and adapted those and included them for each day of the camp week as a way to bring young people, children together and work within this kind of capacity during the camp. And then the next one This is actually one of the facilitators is involved in helping to develop and create the micro-credentials through trauma-informed sensitive pedagogies and practices. Actually, this is led by Natalie, but what Jory did as one of our facilitators is came back and said, I would love to take this particular framework and use it to draw out and build out one of these badges for this micro-credential program. And I'm sure, as most of you know, there's micro-credentials are just the hot topic these days. But so let's go on to the next
13 minutes, just to let you know, 13 minutes.
Thank you. We're just almost at the end. The other is a pivoting who this work is for. So we were thinking about it initially as, you know, creating a model that could be adapted and applied to different community organizations, different teaching, different levels, all sorts of things. But one of the things that we were asked and invited to was the YWCA Regina Power of Being You conference. And that was so completely shifting all of this material to focus on and actually, again, giving this information and strategies of connecting to young people in this environment in this kind of way. And so we presented on it and gave them resources and did interactive games and activities to work with that. We can go to we're almost last two slides. The other components of knowledge mobilization that we're continuing to work on, we are doing a podcast right now for the Let's Talk Research the HRI series. We will be giving a number of public presentations like this one, also for the HRI Research Showcase. We are presenting at a number of conferences over the next little bit, one this coming week in Edmonton. We are doing, and we have done public presentations with community partners and supporting the community organizations when they want to present on the material, thinking about open access publications that we'll be doing, making resources available to our community partners and the public through an online resource toolkit. And this is really about getting the facilitator training manual, those preambles, the podcast, all of these pieces so that they're accessible there. And the final bit, I think that is the final. Are we down to the last slide? Sorry, we'll just go to the last slide. There it is. There's for questions, and also the email there that you can email and follow up with us. So thank you so much, and thanks for your patience through the technical ongoing navigation.
Great. Thank you so much, Charity and Natalie. And your visual images were wonderful. They really brought the work to life. I see there's one question. Which measures did you use in part of your pre and posts?
Sorry, the surveys you mean? In the pre and post surveys?
Which measures did you use in part of your pre and posts? So I'm guessing maybe the surveys, yes. It's typed into the question in the Q&A if you wanted to answer directly.
So we didn't do like a psychological measure or a more what would be considered a more formal measure, because we were just trying to build relationship with the young people. So it's not like we drew upon an SDQ or a whatever. We asked really sort of inceptive questions, get to know you kind of questions. And then how did you feel your experiences were in the midst of COVID? It was funny when we started this project, actually, it was named, you know, post-COVID. And yet, as we find ourselves still in the midst, we've kind of reoriented to that. So anyways, we asked questions that would give us a baseline of understanding of sort of self-reported well-being, connection, disconnection, interest, those kinds of things. So I would say it was more like an anecdotal narrative inquiry beginning to our relationship. We didn't want to scare anyone away.
Okay, great. Thank you to both of you. And you may want to look at that question in the Q&A icon below, and you can certainly add information. And again, I invite you to put an email into the chat in case anybody, I know you had it on your last slide, but if anybody didn't catch that, they can follow up with you. Thank you so much. Love the visuals in that presentation and love the real partnership between researchers and youth. That's just absolutely tremendous. Thank you. Our last presentation, we're doing very well on time. Thank you to all of our presenters. I'm pleased to introduce introduce Dr. Heather Hadjistavropoulos from the University of Regina and Dr. Ram Sapkota, also from the University of Regina. Welcome.
Thank you so much. I'm going to share my slides. Oops. Did we get?
We can see your screen. Wonderful.
Great. It's great. Well, thank you to SHRF and to MHRC for the funding for this project. And also thanks today to our speakers for those really exciting talks on really important areas. And I agree, the slides were lovely. Loved all those photos. I also want to thank the audience today for your time. My plan today is to tell you about the work that we've been doing, understanding and trying to improve barriers to a very specific form of treatment called Internet-Delivered Cognitive Behavior Therapy, or ICBT. And we've been looking at how to improve this for people with diverse ethnocultural backgrounds from Saskatchewan. And I hope what you'll take away from this talk today is that ICBT represents a potential option for care for people who have mental health concerns who come from diverse ethnocultural backgrounds. Before I begin, I'd like to mention that we're based at the University of Regina and are privileged to work from Treaty 4 lands with a presence in Treaty 6. And these are the territories of the Nehiyawak, Anishinaabe, Dakota, Lakota, and Nakota, and the homeland of the Métis Chief Nation. I'd also like to acknowledge the large group that's worked on our project. You'll hear in a little bit from Dr. Sapkota, who's the co-principal investigator on this project. I also really want to acknowledge Emma Valley, who has been the main research associate, who has done the work that we're presenting here today. And then members of the online therapy unit team who have been part of our working group, as well as our online therapy unit interns. And then our community members who really enhanced our project by bringing important knowledge to the work that we do. So many people to acknowledge today. So the work was done in the online therapy unit. The online therapy unit is really about trying to create a new doorway to mental health care for people in Saskatchewan. We know that mental health problems in Saskatchewan and actually all around the world are prominent, and that people have difficulties accessing care using traditional methods like face-to-face treatment. And increasingly, we're looking at digital mental health care as an option for care. And the online therapy unit is really about trying to make this accessible in Saskatchewan and attractive for all people in Saskatchewan. We're specifically concerned about clients who don't have access because of rural and remote location, cost, stigma, or just time as well. Internet-delivered cognitive behavior therapy is our specific focus. In this form of treatment, what we're doing is trying to take what would normally be shared in face-to-face treatment, which is really quite complex, and then put it online in the form of a course, like an online course, but to really try and make that information accessible through text, images, video, audio. Clients are asked to complete weekly lessons. It's different than a self-help book in the sense that it's much more engaging, and also that the information is released gradually over time. We also offer therapist guidance in our courses, but in a different way. There's no face-to-face contact. Instead, that contact is provided through secure email exchanges or phone calls. The course that we were focused on for this particular research project is called the Wellbeing course. And it's a transdiagnostic course that's meant to be applicable to many different health conditions. So depression, anxiety, post-traumatic stress disorder, for instance. The course was originally developed at Macquarie University. It's been adapted by the online therapy unit and then was further adapted for this project. It consists of these 5 core lessons that cover key cognitive behavioral strategies that we know work both face-to-face and online. The materials, each lesson includes, there's text, but also this audio and video, images that support the learning. There's also homework activities each week, frequently asked questions, and then a lot of stories and examples that bring the materials to life. In addition to the 5 core lessons, there's additional resources that go along that clients can pick and choose depending on their concerns. So the online therapy unit over the past 10 years has worked with over 13,000 Saskatchewan residents. We work with adults only, so 18 years and the age and older. And of note, 90% of our clients self-identify as being white. And so we felt like it's really important to be able to understand how we can actually make this more accessible for individuals who identify as coming from other backgrounds. So the overall objective was to understand barriers and then to really try and address those barriers to using ICBT by people of diverse ethnocultural backgrounds. We did a lot in this past year. So we started with archival data analysis, looking at what could we learn from the data that we already had. We then did client and community stakeholder interviews and analysis of that data. Based on the information, we did course adaptations, and we then implemented a new course and did mixed methods pilot study to look at whether we think there were improvements based on this work that we did. I should mention that our patient-oriented working group formed at the very beginning and guided this entire process from beginning to end, including looking at our current data. Well, so we met a total of 5 times, and then in between, there was also work that the participants were doing. Some key contributions included reviewing the data and providing direction, helping with the new course content and client adaptation of client questionnaires, looking at language and understanding differences, providing suggestions for cultural components, helping review our data, and helping with outreach as well. In terms of that archival data analysis, when we looked at the data from past clients, so we had over this period of time that we were looking at, we had 282 clients who self-identified as coming from diverse ethnocultural backgrounds. And we looked at their feedback. We actually learned that they really did like a lot about the course. So they mentioned benefiting significantly from skills, especially thought challenging, controlled breathing, and graded exposure. And then they also did really like the homework and the stories and the additional resources that we already had. And many also mentioned like really appreciating the accessibility and therapist support. So they had a lot of positive things to say. So we knew that we were on the right track, but they also gave us directions for moving forward, especially in terms of making some improvements to content and also to process. So as some examples, they described the stories as being great, but sometimes feeling like they're too long and they weren't necessarily relevant to their situation. Sometimes they found the information difficult to read and less specific to them. And then some lack of personalization. So that data gave us some ideas about what we could improve. We then went into the interviews, and really those same comments were echoed. Lots of positive things to say, but ideas about making improvements, especially around the stories and examples and content. So with that, we set about making improvements to those lesson materials. So changing some of the content and wording, the pictures so that they were more diverse, and also including more content that recognizes social stigma and how that relates to mental health issues, more acknowledgement of social challenges, cultural, political, and economic factors and how they impact well-being. And then we also did kind of an overhaul of the stories to make them more diverse. and then included more video and audio than previously was available to help with learning. I'm now going to turn it over to Ram to talk a bit about some cultural training that we also did within the unit and the results of the pilot study.
Thank you, Professor Heather. Hello, everyone. Yeah, as Professor Heather just mentioned, in addition to what she presented, we also conducted a training on cultural concepts of distress. This training included understanding how cultural background influences our clients' understanding, experience, and expression of their mental health concerns, and also treatment-seeking behaviors, so that our clinicians can better understand the needs of our clients and then be able to help them better. I'll go to next slide, please. Okay, now I will briefly walk you through the preliminary findings from our mixed methods pilot trial conducted to assess if the changes made in the course following patient-oriented adaptation process is effective, and how this diversity-enhanced well-being course stands when compared to the outcomes of our standard well-being course that was being implemented before we made these adaptations. And to give you the background, during the pilot study period, that was about 6 months, 373 patients were accepted to the well-being course. And out of those 373, 49 patients self-identified as belonging to diverse ethnocultural background, that is, having non-white, non-Caucasian background, or identified themselves as indigenous groups. And 41 out of 49 actually started the course. And as you can see in the slide, 53.7% of our pilot sample self-identified as indigenous, and 31.7% as Asian, and 7.3% as Black. There were also participants from mixed identity. And there were more women than men, with age range of 19 to 66 years in this study. And 71% of our pilot sample completed majority of the lessons. 56% completed our post-treatment assessments, and 32% participated in our post-treatment qualitative interviews. And mixed model analysis of our pilot trial using weekly assessments shows that there was a significant pre to post-treatment decrease in anxiety and depression symptoms with a large effect size. Professor, I'll go back to the slide. Yeah, we don't have that slide here because it will come later. And this result was expected because our previous randomized trials have shown that standard well-being course is highly effective in treating anxiety and depression. Therefore, we compared the results of this diversity enhanced pilot project with the results of our standard course to evaluate if the adapted course improves the outcome for the patients from diverse ethnocultural and indigenous backgrounds. Yeah, and post-treatment qualitative interviews indicated that more patients in the diversity enhanced course thought that the course exceeded their expectations, had a positive experience with the therapist, and a smaller percentage of patients said that there is a need to improve diversity in the course. As Professor Heather mentioned previously, we thoroughly revised the stories in the course, but our patients have indicated that there is still room for improvement, as slightly less percentage of patients in the adapted course liked the stories. Next slide, please. Thank you.
Ram, 13 minutes, just to let you know, 13 minutes.
Okay, thank you. The results of this pilot study were compared with our previous wellbeing course, the standard wellbeing course. The pilot study had 41 patients, and there were 134 patients in our diverse in the previous course. And the quantitative results show that there was a significant pre to post reduction in anxiety and depression symptom severity in both treatment groups. But the patients in the diversity enhanced course have slightly better outcomes as indicated by larger effect size for both anxiety and depression. Next slide, please. Thank you. Likewise, in terms of satisfaction with the course and course material, patients in diversity enhanced course were more satisfied overall. This is a non-randomized pilot study. Therefore, the current results are indicative of improvements in the outcomes, and we will need a larger randomized trial to get confirming results. Thank you. I will Professor Heather now. Thank you.
Thank you. So overall, what we feel we've gained from this is a better understanding of the barriers, and also feel like we have made a difference in terms of improvements, and can say with greater confidence that ICBT represents a valuable doorway to care for people from diverse ethnocultural backgrounds. We still, from this work, know that we have more to do. And this is very valuable information for the online therapy unit, and also just generally for ICBT to understand other ways to improve ICBT going forward. I think the biggest way of all of these is the need to do ongoing outreach and make sure that people who come from diverse backgrounds don't rule out this as an option for care. So I thank you so much for your time.
Thank you so much, Heather and Ram. Yes, my goodness, if there's anything COVID did for us, it was to hopefully catapult us forward a little bit in the uptake of virtual services, or perhaps the acceptance of virtual services where appropriate, because it's not for everyone. Very important work. We're looking at very much, we're interested in following that and looking forward to further results from you. Just a note in the question and answer: congratulations to researchers on their successful and interesting research projects. The Department of Psychiatry, Saskatchewan, Saskatoon, and Regina campus is looking forward to connecting with you on potential collaborations. I can be reached at, and there's a research.psychiatry@usask.ca email that's been entered in there. So it looks like the audience has very much enjoyed the presentations. Two quick final things. I know we're very close to time here, which I'm delighted. Thank you so much to all of you for being so respectful of time. It's very difficult to have 3 full presentations in a 1-hour time slot. I would just like to ask everyone that feedback's a tremendous gift. A lot of work goes into organizing these things. A lot of time is taken to present this webinar. So you'll get a link. I think it's being posted in the chat as well, just to let us know. It's 2 quick questions. It'll take you 60 seconds to answer, how you heard about this and if it was useful. We really read all of those answers. It's very important to us in planning future events. And I also wanted to cite that we have another webinar coming up on March 7th, different topic. It spotlights leaders who are focusing on workplace mental health. And this one actually focuses on the 4-day work week concept that's picking up global traction these days. Very interesting. Have leaders from around the globe actually that we're going to be talking to about that, who've actually implemented this. So hopefully folks will join us. I'm going to leave you with one final question to any of our researchers. Obviously, great demonstration of working closely with communities in these research projects, which is core to SHRF and MHRC. Any final thoughts from any of the researchers on how important it is that we develop research priorities with communities and that we actually conduct research in true partnership, authentic partnership with communities? Anybody have any thoughts on that?
I echo that. I think it's great. That community partnership is huge. I think that's a great direction to be going in.
Yeah, and I think me too. I think as I presented, we are working with quite quite unique population that needs lots of kind of encouragement and support. So I think it's important that we continue investing in this key population so that then we can build a foundation. And I think particularly for Saskatchewan, I'm thinking because we don't have like places like Ontario where there's a huge social demographics of immigrant population relative to Saskatchewan. So a lot of work seems to happen there easily. So I think we need to even do more and collaborate and make sure that we can leverage whatever resources that we can lay our hands on it, and for purposes of actually seeing an uptake of interventions for our key populations.
Well, I certainly think that the findings from all of these important pieces of work will be important for the rest of the country, not just for the communities that you're working in. There's so much to learn here and so much to apply to it and move our system forward. So we're very, very grateful you took the time today to share your work, and we look forward to following up with you. A very special thank you to my colleagues who work so hard to pull things like this together, seemingly seamless with a lot of work behind the scenes. And last thanks go out to Saskatchewan Health Research Foundation, to Karen and Patrick and everybody over there. It's a pleasure and a privilege partnering with you. I wish everybody a wonderful day. Thank you so much for joining us, and we hope to see you at a next one. Thank you so much.
Thank you.
Thank you.
Thanks so much.
Okay. Bye.